It has been nearly 3 decades since this virus first became known. But for years we refused to recognize it for what it was. It was coined a gay disease.
The impact of the AIDS epidemic targeted the gay community, leading to discrimination, isolation, and a lack of health care for its victims. The federal funding from Ryan White's CARE Act changed public acceptance of the disease, which led to opposition from the conservative rights movement. AIDS was first diagnosed in the United States by the Center for Disease Control on June 5, 1981.
In 1979 and 1980, doctors in New York and California began reporting that gay men were dying mysteriously. There seemed to be nothing they could do about it. Randy Schultz, a gay himself, was hired by the San Francisco Chronicle to report on gay health problems.
Mid-1981, a number of things happened at the same time. Doctors in Los Angeles noticed an unusual cluster of cases of a rare pneumonia among a group of gay men in Los Angeles. At the same time, doctors in New York City noticed that there was a rare skin cancer that was also appearing among gay men. They were identified separately, but within weeks, people at the Centers for Disease Control realized that there were 2 parts of the same phenomena, that what you had was, for the first time in the history of mankind, an epidemic of immune suppression. That what linked these diseases was the fact that these men were losing their immune systems.
The impact of this incurable deadly disease raised concern about how to protect national public health.
Ain't no angel gonna greet me. Just you and I, my friend. My clothes don't fit me no more. I walk 1,000 miles just to slip this skin.
By 1982, the media had labeled the crisis a gay disease, which was catastrophic to the homosexual community.
Scientists at the National Centers for Disease Control in Atlanta today released the results of a study which shows that the lifestyle of some male homosexuals has triggered an epidemic of a rare form of cancer. Robert Bazell now in Atlanta.
Fear quickly spread across the country, and all people with AIDS faced extreme rejection and isolation due to the gay-labeled and private nature of how it could be transmitted. Discrimination against the homosexual population had a long history. The gay movement, founded in the early 60s with leader Frank Kameny, a gay activist, had been fighting for equality and civil rights. The Medicean, the first gay organization with Frank, fought many legal battles using public civil disobedience and national attention to win victories for the gay and lesbian community, even overturning the American Psychiatric Association's description that being homosexual was a mental illness. The Stonewall Riot in 1969 openly demonstrated the discrimination and violations between government and the gay and lesbian communities. The New Christian Rights movement fought back with concerns about family values and loss of American traditions. Moral Majority leader Jerry Falwell and Pat Robertson openly condemned their lifestyles and behavior and worked to place bans on their rights. The AIDS crisis became a justification from God for immoral behavior to many conservative Christian leaders. By the 1980s Reagan era, the disease research would take a back seat, press Reagan's fiscal policies to reduce government size and spending. AIDS was, however, not only a gay disease. It was soon learned that it could be transmitted through blood and bodily fluids, and the need for education and federal funding was essential to finding cures and solutions for its victims. Ted Koppel described him on Nightline, an extraordinary young man, brave, tolerant, and wise beyond his years. Born 1971, Ryan White was diagnosed a severe hemophiliac. Doctors prescribed Factorate, a miracle drug to combat the disease, but the blood was tainted with the AIDS virus. December 17, 1984, Ryan White was told he had full-blown AIDS and only 6 months to live. He wanted to go back to school, but was banned due to ignorance and fear. The Center for Disease Control reported 1 case of AIDS in hemophiliacs in 1981. By 1984, there would be 52. The U.S. blood supply was now contaminated, and thousands of hemophiliacs would become infected. The Hemophilia Association's website reported the AIDS epidemic has placed great health, economic, ethical, and emotional burdens on affected people and their families. Ryan White had a goal, like many other people with the disease, to live a normal life. In his testimony on March 3, 1988, at the National Commission on AIDS, he spoke about his discrimination. He was banned from his middle school, forced to use separate drinking fountains and restrooms. He faced discriminatory jokes, exaggerated claims of him spitting on people and calling him a fag. He became known as the AIDS boy and drew national attention that gained sympathy by 1988. Other AIDS victims were not so fortunate. Avert.org reports AIDS discrimination can result in being shunned by families, peers, and the wider community, poor treatment in healthcare and education settings, an erosion of rights, psychological damage, and can negatively affect the success of testing and treatment. On a national level, the stigma associated with HIV can deter governments from taking fast, effective action against the epidemic. The Ryan White legislation was the first major policy solution by lawmakers to fund the AIDS epidemic. Ryan White's national spotlight as an AIDS victim shifted public consciousness from deviant victims to innocent victims. Ronald Reagan's neoconservative agenda was anti-communist. Anti-government intervention wanted a balanced budget.
The Reagan administration was still distanced from the disease.
There was an open neglect, if you will, and the failure of the president for many years to even mention the term AIDS.
Jerry Falwell's moral majority represented the neoconservative voters who put Ronald Reagan into office. The voters were outraged against social issues that attacked conventional morality and their religion. The AIDS victims were treated as if it was God's punishment and undeserving of taxpayers' funding. It would not be until 1987 that Ronald Reagan would publicly speak about the disease. Federal legislation to fight the AIDS crisis was introduced by Senator John Kerry and Senator Ted Kennedy. In order to pass the legislation, lawmakers downplayed benefits given to gays by using the stories of 19 AIDS patients with only one being homosexual. It passed with bipartisan support. The legislation was the third largest source of federal funding after Medicare and Medicaid. It provided $2.2 billion to over 2,500 organizations, providing service for 500,000 people. Ryan White dies on April 8, 1990. The HRSA website says on May 16, 1990, as the Senate prepared to debate Bill 2240, the Senate chaplain, Reverend Richard C. Halverson, D.D., noted in his morning prayer that rarely will the Senate be called upon to deal with an issue more complicated by prejudice, fear, and emotion, no more presently or potentially destructive than the issue of AIDS. The Americans with Disabilities Act law bars discrimination against people with disabilities, including AIDS. By 1990, nearly twice as many Americans are dead of AIDS as died in the Vietnam War.
Approved a bill authorizing more than $4 billion.
This legislation converts the millions of dollars of federal research into treatments that are available to the public.
It funded comprehensive care for people with AIDS who couldn't afford medical insurance.
My nephew in the wheelchair, my 4 kids and my mother in 4 rooms, so we stay in the living room on the floor.
It was called the Ryan White Care Act, named for the young man from Indiana who had campaigned against discrimination and had died a few months earlier.
Since the Ryan White Care Act, the epidemic is now a pandemic with no real solutions. AIDS today is a global crisis. An immediate, effective world response is needed to overcome the disease and save the future population from further infections.
So to me, it's clear that I'm not going to see the end of this epidemic. And it's also pretty clear that my children won't see the end of this epidemic. I think we won a few battles. I think most of the time HIV wins.